I want to say beauty means harmony with authenticity. A smile that feels natural to you, not just something that's perfect and ideal, but something that you feel confident in and you feel comfortable, and that improves your overall facial aesthetics and your overall health.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Ekta Pandya, a cosmetic and restorative dentist based in New York, and she's also an NYU facility member and in Sizzle Edge 40 Under 40 honoree. Now, her clinical work focuses on helping patients rebuild confidence through smile design, minimally invasive dentistry, implants, Invisalign, and comprehensive restorative care. She's also the founder of Radiant AI, a patent-pending clinical decision support platform created to make dental treatment planning more predictable and accessible. At the heart of everything she does is a simple goal: combining beauty, function, science, and technology to help patients feel confident in their smiles. So, Dr. Pandya, welcome and glad to have you here.
Thank you for having me, Daniel.
Yeah, so let's start from the very beginning. What first got you started in, or I guess interested in the medical field? Let's go broad.
Well, I was always determined to get into medical field as an Asian. I grew up with the motive of like helping others, and also intellectually driven family where there are only two career choices. You're either doctor or engineer. So that's where it kind of started. But dentistry was unique in a sense. I always thought that I was going to go into medical school. But as I was going through high school, I was very interested in fine arts. And dentistry kind of found a perfect balance of having been able to use my hands with dentistry and surgical skills, and also be in the medical field, service to others, and also being a doctor. So that's how it kind of started. The fun fact, my mother spent a lot of time in dental chair. So I pretty much spend a lot of time in dentist office with her, escorting her or being there with her and seeing like how everything works. So when I actually got into dental school and started seeing patients, it was not new to me. Like I had shadowed at the same family dentist that she was visiting for a lot of time, and I kind of knew what I was doing. So all that kind of came into a full circle, and so that's the story behind how I got into dental school.
Got it. Okay, so now fast forward. You are working as a dentist now, and you offer a lot of different types of services: full mouth rehab, cosmetic smile, reconstruction, which sounds like pretty serious dental work.
It is. It is.
Okay, so can you explain a little bit more on what goes in? Like when I think about full mouth rehab, I guess rehab is not necessarily a term I think most people would think about when it comes to the mouth. You think about, oh, like I broke my leg, I need rehab or something along those lines. But what do you consider when it comes to full mouth rehab? What's involved in that?
So full mouth rehab is I want to say the most advanced thing that goes in when things are so badly broken down, or you have dentition that's worn to an extent where just doing one crown or veneers are not going to fix it. The most simple form of full mouth rehab is dentures. And I know most of the patients are familiar, or layman term, you're familiar with dentures. When you have nothing, you're kind of building everything from scratch.
Mm.
So that's the most simple form of full mouth rehab, which every dentist does in their office. But when it comes to involving that with implants and natural dentition, it requires kind of stepwise reconstruction on how we're going to build this back up with keeping the jaw, the facial aesthetics, the muscles, and everything in mind, where things are going to stay and not break. Because as you go over years, and especially certain patients, it's not for everybody. It's for a patient in extreme situation where your dentition is so worn that your bite and your muscles have collapsed. So you're over closing. So say if your face used to be like this long, now you're over closing, so your face is actually shorter.
Hmm. Interesting.
And patients don't realize that it affects their overall facial aesthetics. It affects their jaw because they are over closing. So they're having jaw pain, they're having muscle pain, they're not chewing as effectively. So in that case, you're building that lost tooth structure or that lost height of the face. You're putting that back. So that's what full mouth rehab is, and that's kind of breaking it down in layman term.
Okay. Now, moving on to the cosmetic smile reconstruction, what's involved in that?
So, cosmetic smile, to the most people's misbelief, we always think like smile is something that's just purely aesthetic. Like, oh, I don't like this tooth that's a little chipped here. That every tooth that's broken, chipped, or crooked tells you a story. Why is it like that? And how does it affect in the overall health? Because even the minor thing like little chipping or breaking, it's never really like a chipping or breaking. I mean, I sometimes you have a trauma where somebody hit you in the face and you have that. But if it's over the years where you kind of breaking your teeth or chipping your teeth, it fits into a bigger picture that it's more of how you're biting, or your teeth are probably crooked, or your teeth don't fit into each other. Because if you have perfect teeth and if you have perfect jaw and muscle and harmony, things are not going to break. So you start with there, that everything you see, you question why. Why is this breaking? Why is this like this? And then you fit into a patient's face. Where should it go? Like where does it belong? And you match that and you create. And with digital dentistry, it's becoming a lot easier now. But back in the day when we started doing this, we would take their pictures and we would send it to the lab, and lab would do like wax up, meaning create where things would ideally go. And it comes back and we create that in patient's mouth. We call that a mock-up, which is just to show patient how it would look
Got it.
or where it would belong.
Mhm.
And then from there we go and we recreate in form of veneers or bonding. That's cosmetic smile makeover for you.
Okay, got it. So now, when it comes to kind of these big changes that you're doing, I mean, I want to move over to the mental side of it. I mean, it's not just fixing the teeth; it's also the restoring confidence and also the functional part of it. So, how I guess is in every situation you're helping people restore their confidence, or is it more people just want the function back, or is it, I'm sure it's probably a mix of the two. But I guess what do you see most often?
I think 90% of patients that are coming in for aesthetics.
Mhm.
Um, there are very few patients who understand the functional part of it. Um, I do see a lot of patients that don't have any back teeth, but they don't care about it. But the minute they lose a front tooth, all of a sudden they start caring about it, because this is how it goes. Like you lose your back teeth, now you're over closing or you're eating with your front teeth and you don't have your back molar support, so you start breaking your front teeth eventually. But usually front teeth are little later to go, and that's when these patients start coming to you and be like, oh, I lost my front tooth. What can we do about it? And surprisingly, a lot of the time they only want to do front teeth, but it doesn't work that way, because if I just do your front six teeth, you don't have any back teeth, you're going to break those too. So you have to start from the back molars, which is your pillar of support, and you have to kind of put it everything together. But yeah, most of the patients are more concerned about their front teeth. But when you're asking about the confidence and the life, it's life changing for them, because even though they are not there for the function part, but the minute they start able to eat properly and chew properly and be comfortable, they are very appreciative. And those are my favorite kind of dentistry to do, because that's when you see the difference, and then you realize that, oh, this is why I chose this profession.
Okay. Now, when it comes to the balance part of it, I'm sure that there's um, the physical balance of making sure you talked about like the back teeth are missing, and that can lead to more issues, but sometimes people just don't care about that. So the balance from a physical perspective, making sure everything is working well in the mouth, but also kind of tying into the balance between their confidence, between how things are actually working functionally. So I guess where do you see the importance of that balance? Is it so that they're not running to think issues down the road, or they're not really kind of losing their confidence as time goes on? Or I guess how do you look at the balance part of it when it comes to function and also beauty?
I think, in my personal opinion, I think I give more priority to function because if you're just focusing on aesthetics and not looking at the function,
Mhm.
you can do beautiful set of veneers and you overlook the function part of it. It's going to fail. It's not going to last. You
Mhm.
have to make sure that whatever you're putting together is going to function well. um, it's just kind of like engineering. Like if you're putting in a car together, which looks beautiful, but you have not put it well together, it's not going to run. The
Mhm.
same thing applies here. If you put in beautiful sets of veneers, but when you're biting and chewing and functioning, if they're hitting in a wrong way, or if they're overloading or the bite is off, it's going to break.
Mhm.
So you have to kind of consider the function first, and facial aesthetics and everything second. And then the later part, like the aesthetic or the cosmetic, just follows if you have just kind of kept everything in harmony.
Okay. And when it comes to technology, now it's getting technology better and better. We have AI. How is the technology and AI changing the way that you're planning treatments for your patients?
I think it's changed dramatically. Like when it comes to AI and digital smile design, we're doing minimal preps, meaning we are preserving more tooth structures. Orthodontics have changed. Like Invisalign is a norm now, so and more patients are accepting it because it's clear trays. You don't have to go brackets and wires, so you can actually move teeth in most ideal position, so you don't have to over prep them or cut them too much. So if somebody had very crooked teeth and you wanted to do their veneers, to get the results you want and to get the function you want, you sometimes have to cut too much of the natural tooth structure to bring it back or to put it in a proper position. But if you do one round of Invisalign or minimum ortho treatment, you can put these in the ideal positions. And sometimes these patients don't even need veneers. Like you just do whitening and they're happy with it, or you do minimal bonding and they're happy with it. And there's just so much AI data, even with these ortho treatment and smile design, that most of these smile designs are going into a direction where you can take a picture, you come to my office, I take a picture, and I can immediately show you where your teeth should be. And we can take a scan and send it to these digital labs, and they can print your temporary veneers, meaning if you wanted to do it the same day, I can do it the same day, which to some of us who have been into dentistry long enough, we know that it would take us like 2 3 weeks to even get the wax up back, and then you start working on them. So it's mind-boggling to me. Like I still get surprised by how fast it's changing.
Mhm. Okay. And with the technology in mind, I mean, you're the founder of Radiant AI. Can you talk a little bit about what that company does?
So it started more as as a frustration, to be honest, because I would get patients who have been to three different offices and they're like, oh, well, this dentist told me this and that. And all of them are right to their thinking and in theory. But patients are not being given options they deserve. And sometimes it's lack of knowledge or not knowing what new techniques are out there, or sometimes it's just the way you're trained. So this AI platform is kind of not going to replace the decision part of it, but it's going to aid dentists and neuro-dentists to kind of brainstorm ideas back and forth. And also, it's going to give you like evidence-based newer articles or research on how you can treatment plan certain cases and what would be the advantage and disadvantage. And that just kind of streamlines it. So when you want to present it to the patient, you can present it easily to your patient, and patient has more clear and concrete treatment plan versus, oh, we can also do this, but we can also do that. And that just doesn't work well for patient.
Okay. Now, when you're dealing with patients, I'm sure you hear a lot of myths, a lot of misconceptions they have about what you do, especially I would imagine for the bigger treatments. But what are some of the most common misconceptions or myths that you hear?
So I think the veneers are like, oh, you have to cut your teeth to little snubs. Like with newer technologies, you don't have to really always have to cut your. Now there are a lot of prepless veneers, meaning you don't have to prep your teeth at all.
Mm.
So that is something that's the big misconception about it. Also, when it comes to doing smile reconstruction or like full mouth rehab, patient usually think it's more for like aesthetic, and they don't think so much about that it also the function part of it, meaning they think like, oh, but I don't really want pretty smile, or I don't really care how I look, I just want to make sure. They don't understand that if you are not doing something like that, you're also putting your teeth into risk of breaking more, or it's affecting your jaw, it's affecting your overall health, all that part of it. Because when your mouth is over closing, or when you don't have proper back teeth, it can also cause your tongue to fall back and make you more prone to sleep apnea and things like that. Or when you have too constricted, like your teeth are too constricted and narrow arch of the palate, it can also make you prone to sleep apnea. So doing orthodontic correction or doing full mouth rehab, it can open up your bite, hence prevent you other health problems too. Um, so that part of it is not, I think, really well like patient education is not there, and that's where we come in, where we have to educate the patients.
Got it. Now, let's say that somebody is looking to get help with dental work. What advice would you give to that person? Let's say they've never been to a dentist before, or maybe they just go to like a general dentist, but they don't go to a specialty one and they need that specialty one. So, what advice would you give this person as they're doing their search to find that right dentist who has the knowledge, has the experience, has a skill set, and can really help them get the end result they're looking for?
I would say whenever you go to your dentist, ask them the right question. Like ask them how things are affecting their function, or how are they treating the actual disease, not just the symptoms. Because most of the time when you go to a dentist and they tell you like, hey, Daniel, you need a filling. And you're like, okay, let's do the filling. But are you questioning like, how are we treating it that I don't get more cavities in future? That's the core part of it. And if you don't have a dentist like that, then you need to find a dentist like that, because you don't want to go to somebody who's just kind of fixing the symptoms, and not actually educating you on like, why are you getting cavities, or why are you breaking your teeth, or why are you having jaw pain, all that stuff. Like you need to make sure that you need to educate for yourself and be like, hey, why did that happen? Why did I crack that crown that was put in 2 years ago? There's usually a story behind that. Um, and that's the part of it. I mean, the cavity part or the gum disease or anything, if you're just doing a deep cleaning, but what am I doing, or what are we doing as a daily maintenance to make sure we don't get more into that?
Okay. And what role do you believe creativity plays in how you approach patient care? Because I think a lot of people think about dentistry or medicine, and creativity is probably like, don't be creative, just follow the plan. But I mean, what role do you believe creativity has in what you do?
I think creativity is the part why I chose dentistry over medicine, because I feel like dentist has more room to be creative than anybody. And the biggest part is like when you see like like apart from maybe plastic surgeon, you could be doing like beautiful surgery, or you could be doing beautiful treatment for your patient, or you did beautiful sutures, and nobody's going to see them. But in dentistry, you could do like a couple of bondings, and it's an instant gratification where patient gets up and takes a mirror and be like, "Oh my God, doc, you did an amazing job." So there are a lot of ways to be creative, like, even if we are giving provisional crowns or bonding. So that's the part I enjoy about, like, working in dentistry. So I
Mhm.
think creativity plays a bigger role in dentistry.
Okay. And when it comes to, I guess, the future of dentistry, where do you think the future is going?
I think future is definitely the more technologies are coming. I want to say next 5 years, we're going to see a drastic change in how we practice. And I think it's going to lead more towards the whole mouth and body connection rather than just focusing on teeth. It's going to be more of like how teeth are connected to the body. There are a lot of salivary diagnostic coming through and incorporated in daily practices versus they were in the past. And advanced technologies, like, as I was just saying, that there are a lot of same day transformations, patients coming in with no teeth in their mouth, getting implants and getting same day dentures, like fixed dentures, which are kind of like screwed in like bridges, and which was easier with AI and newer scan technologies. There's photogrammetry in dental field now, which we can just catch exact position and print exact teeth for these patients, which is amazing because it's getting better every day and it's becoming cheaper. That's the bigger part of it, because some of these technologies have been there before, but now since it's cheaper, more people can afford it. And I think that's going to change. And AI has been kind of helping in the background, but now since it's a common word, it's more relevant in today's scenario where it's going to change things.
Okay. And throughout your experience, I'm sure that you've worked on a lot of different cases. Maybe some were more challenging than others or memorable than others. But is there one story that you're able to share of just one of those cases, and how you were able to get them a successful outcome in the end?
So one story that sticks out to me, a very good patient of mine, like she's 44-year-old, beautiful, beautiful lady. She had a car crash and dislocated her jaw, had a couple of jaw surgeries done. But after that, her smile changed, her bite changed. And she ended up with open bite, meaning she couldn't close back all the way. So she cared about how she looked, but more she cared about was like she couldn't bite into food and she couldn't like cut into an apple and like bite into it. She would have to chop it up and put it in the back of her teeth. And she went to a couple of dentists, and all of them just said, like, oh, this is what it is. Like, I don't think so. We can do a lot. Her teeth were like very crooked and severely in a position where ideal results were not going to happen. And she had been a long-term patient of mine. So she was like, hey, do you think I can do like, I had this like long time ago. I talked to a couple of people, but they said that there's nothing much they can do. I would really like. And I was like, you know what? I can give it a try with Invisalign, which is a clear aligner therapy. And we did like one round and she was very happy with it. And there were a couple of teeth that were still crooked. And I was like, I can do some bonding because these teeth are in better position now. Her main thing was that she wanted to be able to chew. Like aesthetics was like a second thing for her. But we were able to give both to her. And I feel where previous dentists kind of failed is like they were focusing on perfection and ideal treatment plan. Where along the line, where no one listened, was like what she really wanted. And I think sometimes we need to kind of have that human connection, be ability to educate patient what's possible and what are pros and cons of each treatment options. So I think that was a life-changing experience, and it kind of gave me another perspective on how I practice and how I see things and how I present treatment plan to my patients nowadays.
Got it. Oh, it's a wonderful story you shared. Now, Dr. Pandya, I do have one last question for you, but before I ask it, I do want to point people to your website at drektapandia.com. Now, last question for you. What does beauty mean to you?
Oh, that's a good one. I want to say beauty means harmony with authenticity. A smile that feels natural to you, not just something that's perfect and ideal, but something that you feel confident in and you feel comfortable, and that improves your overall facial aesthetics and your overall health. So, yeah, harmony with authenticity.
Okay, well, there you have it. Dr. Pandya sharing your expertise. So, Doctor, where can people contact you or learn more about you?
Well, they can reach out to me on my Instagram. It's a Ekta Pandya DDS on Instagram.
Okay, awesome. Well, this is great. Thank you for coming on and thank you for sharing your message.
Thank you, Daniel. Have a lovely evening.